Can you all see my slide here? Does that look good?
Yes, sir.
All right, excellent. Thank you so much. Okay, so again, even for our seasoned ship coordinators in the room, there is absolutely always a continued opportunity for us to improve our program management approach. No one is perfect, including myself. We all have got a margin to continuously provide higher value in the work that we do. That being said, we've got some objectives today that regardless of your tenure, we hope that you can walk away with some new tools in the tool belt, so to speak. We have our primary objectives being we want to recognize the compliance updates, many of which that Krista has spoken to in terms of how we're progressing forward with the SHIP grant and the expectations that we have for the future of the program. We want to equip you all to identify opportunities within your program to continue to really make it work more efficiently for you, be able to manage and not just your partners that you work with throughout the grant programmatic year, but also the long-term potential for the grant over the next 5-year period. We want you to be able to really continuously, incrementally improve your program. And we're hoping that today we're going to talk through several different practices that have been successful for other programs across the country and even within our own organization and in rural. We're going to handle a few of the tools and techniques that have allowed them to be highly successful. And then we've got a really great panel today with us that's going to discuss what's worked for them. So we have an exciting and packed agenda here. As far as the SHIP updates, we're looking for our best practice nominations. So you may have perceived that if you're one of our dual hat, half flex, half SHIP coordinators, you've probably already seen this, but any recommendations for high performers around financial solvency and leaders of the pack, we would love to hear your recommendations on that so they can share their success and we can give them credit where credit's due. Of course, we, for those of you who are still working through processing applications, we do have our April 2nd date for feedback on the primary application, and then our EMS by the 12th. And then we've got Learning Collaborative coming up on the Flexside House. And for those of you who applied for the SHIP Learning Collaborative, thank you very much. That's going to be fantastic. So very much looking forward to working with all of you here this coming month. So just so we're all on the same page here, when we're talking about optimization, of course, it's kind of implied, but just so we're on the same page, what we mean by optimization is the act, process, or methodology of making something, where we're talking a program in this context, as close to fully perfect, functional, or effective as possible. So anything that we can do to work that direction is what we're talking about today. Of course, we can't go around the fact that you can't work towards perfection without having a continuous improvement mentality and methodology approach. Of course, I'm sure many of you are familiar with a PDSA cycle. Some of the stuff that we'll cover today will be new to our new coordinators, some of it which our prior and long-term coordinators may have had some experience in actually application of this. The PDSA cycle, or Plan, Do, Study, Act cycle, is great for its simplicity and is highly regarded in the program. So if you don't have a continuous improvement approach, that's the one that we tend to lean towards in the program. There's other options as well. So we Kai meaning change and Zen meaning for the better is a concept that originally came from Japan, and as a key principle to that is incremental changes towards improvement and getting all team members in your SHIP program involved. We got total quality management. Of course, many of you from the clinical side may have heard of that as well. Lean, and actually, Lean is one of my favorites. Value stream mapping. When you look at any program, There's typically value that's created, and then there's a whole lot of superfluous stuff that may or may not be helping you. And if you take a critical look at that, you can really get down to highly efficient, high value return on what you and your program and your program's partners are doing. We call it go to the Gemba, but it's basically the place where value is created in your program. So that's definitely recommended to explore that methodology too. And of course, Six Sigma. Many of you may have already had the opportunity to explore, have some training in Six Sigma. If you do have a chance to get maybe perhaps some additional professional development training through your organization or maybe your partners, we encourage you. The important thing is that you're adopting a continuous improvement mentality so that you can continue to refine and really make your program work more effectively for you. A technique that can help you to address those issues is to perform what's called a gap analysis. So many of you probably heard of a gap analysis, but essentially it's a method in which it involves comparing a current state or process that you have with a desired state or process. There's systematic steps, and they're listed here for you. I don't have to read all of these out to you. You certainly can are capable of reading that too, but it's important that you get really granular and specific about identifying your current process, all the sequential steps to that. A really important thing is that you define in criteria. You can't just say, I'm conducting a gap analysis on everything. It has to be a very specific scope at which you're taking a very close analytical look at. And then from that, if you have, let's say it's the contracting process, let's say it's your sourcing contracts, subcontracts, or even the communication and how the deliverables and timeline is affecting your program and making you run up on deadline for your reporting. So whatever that the crux of your program is, you can take a look at this as an incremental gap and really define, here's our current state and here's the future state we want to be at. And the key is that you develop and prioritize action plans around it. So when you've got to a point where you can identify, okay, here's our gap, here are the steps that we believe we can take to improve it, develop action plans and implementation steps where you have accountability for who's going to accomplish those and that contingencies on time so that you progress to implementing and then evaluate it again, see if it works for you. But there's tons and tons of information on this that's available and free online. We certainly here at the center and the ShipTA team can talk with you and further this discussion another time. If you feel like you want to take this systematic approach toward solving some of the challenges your program may be facing, we're certainly here to support you with it. But that is absolutely a very valuable industry tool that can help you too. Another technique is process mapping, and many of you may have already experienced this or started this, but essentially you have to understand how a business process works in order to make incremental changes to improve it. So it's kind of like the same thought process is you have to understand it, your process, get it under control before you can actually make steps toward optimizing it or improving it. So there's many different free and available tools that help you to build out this. And what's the advantage of this is that if you take the time to map your process, it can help improve communication between you and your state's partners. It can increase clarification from your partners, even within your own agency, as far as your process and the things you're looking at trying to refine and improve. It can increase transparency and understanding for everyone involved. And it's easier to identify areas of improvement once you've taken the time to map this out. And of course, it aids in efficiency and once you start integrating that continuous improvement to it. There are many different ways to create process maps for your program. Here's a few helpful tips to consider. Simple and consistent notation helps everyone involved. You want to identify the key individuals with internal and externally that can help you really define exactly each incremental and sequential step that's going on. And you want to gather accurate data while you map out your process so that it's high quality what you end up with. And then, of course, make sure it's easy to read and understand. There's no need to make things more complicated than they have to be. In fact, the less is more to quite a degree. And people can understand things that aren't super technical and complex. And it's more important that everyone is on the same page than it is to be extremely granular and technical when it comes to this. So here's an example. This actually applies for all of you. This is how we address SHIP TA requests that come in. So many of the new coordinators here may have seen this. There's more than one way we receive SHIP TA within the program. There's a plethora of tools that we've created here. So you've got, of course, the allowable investments toolkit. You've got the search tool. You've got PDFs that you can share with your hospitals. And the expectation for the future of SHIP is that you are leveraging those because there's a ton of time, energy, and effort that goes into making these things updated and available to you. So, of course, if it's more complex than that, which I am a firm believer of doing due diligence to and ensuring things are approved, we're here for you. And this just goes to show, as an example, if it's a complex, sometimes you all submit requests that are multifaceted, multidimensional, very complex, and we have to collaborate with your project officers and here internally before we can generate, a articulate response to you. We want to be 100% accurate with that. So this is an example of that is the case, and we need additional information. Then it may take up to 5 business days is our intention and our response to you. But you can tell this isn't overly complicated. It's not, 500 different steps in this process. And the simpler it is, the easier it is for everyone to understand. So we can certainly touch base with you all to discuss this in detail if anyone has clarification or has questions about it. But that's just one example. The point is it can help you and get everyone in your program on the same page to map out the steps that are necessary for you to be successful in your program. Another tool that is frequently used and very helpful when you have dependencies and you have time contingent steps that you need to fulfill to be in compliance with a grant. This tool was developed by Henry Grant, who's an American engineer. It's essentially a horizontal bar chart used to display a start date and duration of task and contingencies of task. So Gantt charts can be made in a variety of different ways. The task in a project is represented on the y-axis of a Gantt chart, and the duration is represented on the x-axis. They let you know which steps or which tasks within your SHIP program can run in tandem or simultaneously, and it's an easy visual representation to see which ones are contingent on the other. Not an overly complex tool to use, but it can help you to stay proactive in how you're managing the requirements on your end for the program. And then you're not run up on a deadline and needing clarification and last minute having a mountain of back and forth with the POs to address things because you've proactively been able to identify it early on. So here's an example using our timeline here. Of, doesn't have to be complicated. It can be as granular as you need it to be. And it kind of helps you to be proactive on the things that you need to be working on, the when and who you might want to reach out to. Another method or analytical approach that's very helpful for understanding what your constraints are in your program is what's called a critical path method or critical path analysis. We have resources here internally that we can, if anyone has additional questions about this, we don't have a ton of time to get into the specifics of this step today, how to walk through this. We're happy to circle back with you at another time to discuss this with you in detail. But essentially, the Cliff Note version is that this method allows you to take a process and all sequential tasks in it and identify which path within that process, if anything within what's called this critical path within that process get delayed, then it's at risk of pushing you past your deadline. When it comes to things that have hard stops, and you've got to ensure that you receive certain deliverables from the hospitals or your state's partners so that you can meet your requirements, this is a really good way to look at your process to figure out, okay, here are the things I want to ensure, I want to monitor closely so that if we do start getting off the rails a little bit, I can proactively reach out and ensure that we've got time to manage it appropriately, should there be a formal change request required or otherwise. It's a very good technique to use that can help you stay on track. And you can certainly find lots of resources online, but we're happy to discuss this with you further if you think it would be helpful. One of the questions that we frequently get, everyone wants to know, okay, when it comes to scheduling, is there an ideal time or buffer? How do we, basically back up a due date from our hospitals or a hospital association or our partners? How do we kind of modulate that so that we don't get ourselves in trouble? It really depends on the situation, but I know it's not what you want to hear, but here's a few things to think about. Some believe that, plus or minus 20% is a good threshold, whatever your total timeline is on a project. If you add 20%, that's maybe a good starting reference. Some like more, some like less, as far as the timeline on when your final deliverables need to take place. But it really depends on the associated risk of a project too. Obviously, if you're dealing with hazmat, SpaceX engineering's got a little bit more risk than some a project of a lemonade stand on the corner. So it depends on how the associated risk of a project. It depends on the inherent complexity of cost is obviously a factor too. The known duration is a factor. And then, of course, the reliability of your state's partners and who you're working with is a huge factor too. It's important you're thinking about it and trying to approach it systematically so that you can stay proactive at managing your program and ensure that if there is a formal change request that's needed, you've got time to adjust for that. Another technique that's highly regarded in process and risk analysis is called a failure mode and effect analysis, or FMEA. Similar to a cause and effect analysis, it's a common engineering tool used to identify possible or potential failures in a program, process, or design. Many of you may be familiar with the 5 whys. Well, the FMEA ensures that you take a critical look at, here are either the existing or potential things that could go wrong with what we have planned. That will help you to identify this continuous improvement in the program. What can we do to build out smooth processes that will not create issues for you, will not have you running into problems at the end of your grant period? It's a technique that there's additional resources available for. We can certainly walk with you through this. If any of you have questions about it, or you feel like you really have a crux in your program you could use some help analyzing, we're happy to assist with that too. But consider that as well if you're looking at addressing some major challenges in your program. The other thing, I won't spend a ton of time on this, but many of you have probably heard of a business continuity plan. We talked about several different things here. We talked about gap analysis, process mapping, scheduling, other tools to analyze risk. It's important that you're considering if you have a primary plan or your alternate plan or contingency plans, that you're able to be flexible in managing your program. Our state offices struggle a lot with, there's turnover in the state offices, and there's turnover with the partners that you all are working with. For various reasons, this can be a challenge for some states more so than others. But what's important is that if you are taking the time to build out your systems and your capacity and map these things and develop policies and procedures that are efficient and are working for you. Take the time to document those, take the time to create a reference for your agency and your state's partners so that if you get promoted and move on to be the bureau division director of your organization, you have got the structure built in there so that your SHIP program will continue to be successful in the future because you've improved your program systematically. It's not contingent on who happens to be in the seat at that given time. You've actually leveled up your entire program systematically, and you've taken the time to do that. Some of these tools will help you to do that. The other is that, if you're fostering a culture that encourages collaboration and transparency, and partners or contractors or anybody or hospitals or otherwise, if they're dealing with challenges or struggles, they want to come to you because you will receive them well when things don't go as planned. I know you all heard of Just Culture before, but this also applies here with how you're building out your program for the future. And ultimately, communication is key. We've got a complex environment. We deal with a lot of health systems that have a difficult job to do. Ensuring that you are a true advocate for them, a genuine resource and help to them will go a long way, having that authenticity. Lastly, I'll just say this, that when it comes to business continuity plans, you'll hear that term. I'm not just talking about, staff turnover in a state office. Typically, you hear business continuity plans when we're discussing a plan to ensure personnel and assets are protected and able to function in the event of a disaster. So you'll hear most agencies should have a formal continuity plan. It's one thing that COVID taught us is it's worth getting more staff involved in reviewing and updating these BCPs regularly, especially now with a geopolitical, cultural, biological, cybersecurity, everything else that you could possibly name out there. It's a good idea to be familiar with those with your agency and then consider those as you're building out your program to ensure that we're all on the same page and here is how we're going to handle X, Y, or Z. Lots to consider there, but ultimately, again, back to communication. You've got stakeholders and partners, all of your hospitals, and everybody communicates differently. We all have our own. Some people, you won't have any luck unless you pick up the phone and call that CEO, and then that's how that CEO prefers to communicate. Others, they have to have everything in email. It has to be they have to think through it. They need a week or two to marinate on it before they can respond. So learn the preferred communication of all of your partners and work to try to continuously improve that cross-functional communication so that your program continuously becomes easier and easier to manage and increases transparency and collaboration between all of you. And I've got just a couple more slides and I'm gonna wrap it up here because I know we want to get to our panel. I do want to mention project management. If you have the ability to receive additional professional development training, either through your organization or perhaps your state's partners, want to encourage you to try to pursue that. Any PM training you can get will help you to manage your program better because essentially you're managing projects throughout the year. Same principles apply. Some states have been able to make a case for leveraging technologies to do this. There have been states that have been successful at bringing on new technology to help them manage projects for the state off multi-grant functional capability. If you choose the right technology, it can be very, very helpful to you. So everything we talked about today, you can approach with basic Excel or Outlook. Certainly, if you have the means to do it, many of these options will make your life a little bit easier, and you can make a justifiable case for your agency in bringing some of these technologies online to make the value of the services the state office is providing work more efficiently, increase transparency, be in better grant compliance, and so on and so forth. There's lots of value to this. We've got some great links here for you to explore that. Maybe continue that conversation, and we just encourage you to consider it. And if it's something you feel like would be valuable, make a case for it. You never know unless you ask. We've got lots of other links and references historically here of other things that perhaps the new coordinators have not had a chance to see or review or try to study from. And then we've got some that our perhaps our senior coordinators haven't seen in a while. It might be worth a good refresher. So we'll have these links to you too. Please take the time to review those. You know, this program, in order to run it successfully, we have to continuously kind of work on building our skill set. So absorb those whenever you have time, and it'll make your life that much easier. Lastly, I just want to say that, you know, Krista and I and the rest of the SHIP TA team, we understand that this job is not easy and nobody's perfect. And just please always consider that when you have challenges or you got a bad day and you're dealing with just a mountain of difficult stuff, that it's just an opportunity. And you don't have to let it be weight on your shoulders. It's not bearable. You can handle it. Just treat it as now we got an opportunity to improve. So don't take it to heart. Just try to keep that positive outlook and mindset, and we have the utmost faith that you will absolutely be successful managing these programs. We've got a fantastic group here today. One of the things is we talk about this a lot and conceptually in these webinars. Like this is what a theory is. What we really want to hear is how do we apply this? What conceptually is working for the other SHIP coordinators out there? We have several states with us on the call that I have previously mentioned. I don't have my I can't see you all right now. But if you're one of our state coordinators that has been with the SHIP program for a while and had lots of experience now and lessons learned and what has been successful and what hasn't, please feel free to chime in. We would love to hear your take on the following question. And I'll just open this up for open discussion. Feel free to take yourself off mute and chime in here. We discussed a lot of different strategies here, but what have you used that's been most valuable to optimize your program since coming in as the new SHIP coordinator? Hey, Nicole, I see you. Go ahead.
Hey, I would just say to those who are newer and acclimating to SHIP, look at your most current NOFO or your NCC, whatever your most current cycle has been. There's an attachment in there that would be your work plan. And so if you're looking for a good starting point on what was specifically written for your state, those steps should be outlined in your work plan that had been submitted either in the NOFO or the NCC, whatever you happen to be in for the cycle. I know when I first started, that helped guide me tremendously in knowing what I should be doing at the moment. And then it's kind of a good starting point to learn where those opportunities for improvement might be as you're implementing that work plan.
Excellent. Thank you, Nicole.
Mm-hmm.
And Cinder, you look like you had something to say too, or Stephanie?
I have something to say. So this is Idaho. I think mapping out a Gantt chart is very helpful as far as just timing of how everything falls with other grants that you may be overseeing and things like that. It just helps if you have another person that you're working with, be able to kind of communicate priorities and capture sort of who's responsible and then the time frame for that. I do think that's a helpful tool to have.
Thank you, Stephanie. Go ahead, Cinder.
I am kind of the old school line and I use paper and files, and I really appreciate your new technologies and new softwares, Nick, but all I do is I just have my big files, and I look one by one. Oh yeah, there's that bill that we paid. There's the bill we paid. There's the bill we paid. And so I haven't jumped into the new technology, although I really appreciate it. I would say my biggest strategy for getting any kind of response and compliance and good work done is the relationships that I've developed with the hospital personnel. And that's taken a long time, but if those folks get an email from me, because we have a relationship, they will respond very quickly most of the time. And rather than playing phone tag or waiting weeks and weeks, because we have those good relationships, there's typically a good response if I have a question. So it takes some work, but that has been a real benefit, is just having a really good working relationship with the individual hospital folks that we work with.
That's great. Thank you, Senator. And that you're absolutely right. What works for you is likely to be entirely different than what works for me. What's important is you're figuring out what's working, what works and what doesn't work. And absolutely, it's all about the relationships. It looks like, Lindy, looked like you had something to say.
I do. I can't figure out how to raise my hand on these things because it's all different. So, when I first started out, I was thrown into it unexpectedly into SHIP. I was already doing Flex, and I am a big flowchart person and a policy and procedure person. And then thinking, and because I was thrown into it, the next person will probably be thrown into it too when I leave. And so as you're going and making, it's trial and error, right? I mean, we read it, we read the NORFOR, we read all the rules, we do our work plan, but then to actually implement it, I start with a flow chart. I'm kind of like Stephanie, I'm very visual, and just start adding to it all. And I still, write down those things that I want that next person not to do or to do correctly. And then write up a procedure, just a quick little 4-step thing. I think it's really important because that next person that comes after you, if you can document your processes and how you got there, it's really important.
That's great. Thank you so much, Lindy. Map it out where it makes sense and everyone can be on the same page. And Kate, it looked like you had something you want to share too.
Oh, sorry, I've got a cold. I was just going to say, don't hesitate to reach out to other coordinators. That really helped me when I first started. Everyone has always been super happy to help. And if someone else has a tool that they're using, like if they have a Gantt chart that works well for them, they can just share it with you and then you've got it. So there's no reason for all of us to be totally recreating all of our own stuff. We should all be sharing with each other.
I
Love that,
totally
Kate.
agree with that,
Go ahead.
Nick. If I could just say,
Certainly.
I think that's a really good point about reaching out to other SHIP coordinators. And one of the questions that I have, and I do believe that this relates to optimizing, and I'm trying really hard, from the outset, the messaging on this was a little bit tough to hear. So I think part of my challenge is, monitoring has, from the federal side appears to not be occurring the way that you would like to see it. And you feel like there's more deficiencies than you've seen in the past, and that allowable expenses seem to be getting more on track, but have been a challenge. And so I guess one of the things when I see about optimizing the program, some of the challenges, and I know this because I've talked to other SHIP coordinators, is that it's confusing, right? And when it gets confusing for the end user, it's confusing for the hospitals, it's confusing for the coordinators, and therefore what you're getting isn't what you want. And so when you look at optimization, I really do think there are opportunities for us to discuss how to make SHIP more effective and efficient so that you get what you want on the federal side, and we're able to do our jobs better because nobody wants to be late with an SFR. Nobody wants to not monitor or like fully expend their funds. Everybody wants to be successful. So help us to do that. And I would say one of those things is starting from the application, right? So if ICD-11 is a priority, which is a challenge already because it's not released and we're talking about it and they don't use it, and now you have to spend all this extra time and energy to try and make that number one, a priority when it doesn't exist, and number two, spend your money, or if not, tell me how you're going to do it, even though it doesn't exist, and be ready for it. The application doesn't support that. And then when you go to report in Salesforce, that is confusing because you're having to mark it even if they don't spend the money for it, and it's not clear. And I know it's not clear because I've talked to other SHIP coordinators about it, and that's part of that optimization piece. So making sure that from the get-go, and I think this is where maybe Task can help, making sure that application captures the information you want from the very beginning. And then I think if we could have like a subgroup of people to talk about, like now when we had an Excel spreadsheet, and I know that that was not beneficial on the federal side, but now it's almost like double work for the coordinator who's also trying to capture the information as we get it from applications. And maybe, you know, Salesforce will be open earlier so we can be building it as we go, but it almost seems like an extra step. And so trying to figure out efficiencies as we are working together, so, because we shouldn't do this in a vacuum. And that's where I'm saying, like, what Kate said really spoke to me, because there are times, and these allowable costs have become more and more complex. You can't have a consultant, you can go to a training, but you can't get CEs. You know, people want to spend the funds, but it is getting harder and harder to find relevant ways to spend the funding. So when hospitals come to us, because they would also like to spend the funds, and we have to go to task every single time, at least that's what it feels like for me, to make sure something is allowable or not. Totally agree. You guys are very great at answering the questions, but it shouldn't have to be that hard. I hand out the allowable costs, I hand out the link to the tool, I use the tool, I use the allowable costs before I even go out to you. But if you want to talk about program management, and I appreciate all of these tools, and I really respect the work that went into this, there are some efficiencies that can be made for the entire group so that FORHP gets what they want and that we are able to do our jobs and help support the hospitals who ultimately are the ones that need to use the funding. But it's getting harder and harder. And I am a person that actually had, for the very first time ever, an extension for an FFR, and then even had it late. That was mortifying because now I'm working with people that I don't normally work with to submit an SFR because I don't do it. And I'm having to have all these background conversations, which nobody sees, but it looks like a delinquent SFR. And the messaging that I'm hearing, and I'm sorry, I'm taking it personal because I'm looking at the opportunities, but it's not because you want to be delinquent. You know, there's other things that are happening. Our entire state shifted to a different system for invoicing and personnel, and it's almost like an EHR, right? So you get that from your hospitals as well. Steph, I'm running late, you know, I wanted to do this with my SHIP fund, couldn't do it. So you're brainstorming. I do probably more monitoring with SHIP than I ever have in the past, and more monitoring than is given credit for, because I want them to be successful. And if I'm having to work twice as hard to monitor because allowable costs are so difficult, you can have whatever kind of tool you want to have, and you can have proactive conversations as much as you want. And I have great relationships. I mean, I'm pretty humble about everything, but I have great relationships with these guys to help them. When it becomes hard to spend funds in the right way, and you have to ask almost every time, it's not efficient and it's not effective. So we need to work together to figure out how to make this better.
You know, Stephanie, in your defense, we've had a bit of a moving target, not only within your state, but even when the implementation of Salesforce, and we have lots of change going on. Is kind of where we open this up today. But we absolutely, this is a two-way street. We're looking to continuously improve our services to you all. We want to, we can continue this conversation at another time, Stephanie, and for anyone else on the call, if you got recommendations on how we can make this program work better for you or easier for you, we are all ears anytime. And together we're going to try to ensure that we're creating the most value directly to those hospitals. So I empathize with you, Stephanie, and thank you so much for that. We've got another question here, and then we're going to have to wrap up here in just another couple moments. Are there any other tools? I'll put this out to the group too. I know we talked about our Gantt and flowcharts and process mapping. Are there any other tools that you all have found helpful? And I know one of the big ones is we hear quite a bit from the states that have improved their communication with their hospitals by generating either a fillable PDF or something that eliminates variance. Part of the reason why we're all looking forward to this Salesforce, although to Stephanie's point, you're still tracking much of it in Excel, is when you have lots of variance in your data fields, it makes it really hard to collect data because everybody's has 1,000 versions of saying the same thing. Are there any other tools that have helped your communications with your hospitals, have helped to ensure that you're getting concise deliverables being met? I'll put this out to the group too. If there's anything that's been really helpful at kind of streamlining that for you all.
I can share, I've used JotForm, which is kind of like SurveyMonkey, except for forms. And so I'm able to restrict fields so that I can only get the information that I want. I'm able to restrict the amount of money that people ask for so that they're not going over. And then it has an automatic feature to be signed by the SHIP coordinator, and then it's automatically sent by email to the CEO or administrator to sign. So that's made it much easier. And then when they do their final reports, they can upload their invoices right to that job form. And then I also include the instruction, like the specific instructions for each year right there. So like, okay, first you have to be picking ICD-11 or whatever it happens to be for that year. And that has really helped me.
That's fantastic. Thank you, Kate. And Lindy, you have something else to add? And Caroline, if you don't mind, if you'll please launch our polls. Thank you all so much for completing the polling too while we wrap up here. Go ahead, Lindy, you had one more thing to say?
Just adding on to Kate, I did a similar thing with SurveyMonkey, and we're a state agency, so we have to do contracts and deliverables and invoices. But if you look at your final report that you have to give to FORP at the end of the year, and then custom that SurveyMonkey to match up, it'll be easier for you to fill out your final report with the questions they want. And then I give it to them kind of early. I give them midway, just so they get a heads up on what I'm going to be asking for at the end. And then we don't pay them until they've completed that final report and the deliverables. So that was just a add on to Kate, because that was a great idea. I've got to try that new other software though next time.
That's great. Thank you so much, Lindy. Is there any other pro tips before we wrap up here? And I think that we really appreciate all of your feedback, seasoned SHIP coordinators here. And thank you all so much for completing the polling too. Again, we're here to, be a resource for you if you've got additional questions, or if any of the techniques or kind of tools that we've discussed today, if you'd like more information on those, we can certainly continue our conversation. And then, as we mentioned, while we continue to move forward and try to build capacity for the program nationally, please build off the peer network. That was one of the big things that were mentioned here. You can learn so much from each other, lessons learned, and what there's no reason to reinvent the wheel if the if people in the room have found something that's successful, you can adopt. You don't have to create it on your own. Please take the time to network with your peers. And that just helps us all to improve collectively. So thank you so much for your effort on behalf of each other. And with that being said, if y'all got further questions, don't hesitate to reach out to SHIP TA anytime. And thank you all so much for being with us today.